Good evening, everyone. This is Sri Kumar Swami Veer Maheshwar Charitable Trust Latur organizing daily international webinar series. This series is running from last 5 years and we are inviting the speakers from India and abroad. This series covers the topic related to education, law, health, medicine, environment, technology, space technology, etc. Every day we are enriching in the knowledge through the speeches from various speakers on various topics. Today, on 15th April, we welcome our honorable guest Pallavi Pai, who is medical student IMG Tbilisi, Georgia, from Georgia, and her topic is robotic surgery, a new era. She is dedicated medical student at Tbilisi State Medical University, which is working on the coverage of medicines and artificial intelligence to the advanced field of robotic surgery. Her primary interest lies in the exploring how AI can be realized diagnostics, personalized treatment plans to optimize the surgical outcome to the significantly enhance patient's care. Through her rigorous academic journey, she continuously seeks to integrate AI driven insights to her medical training, equipping herself with the skills and knowledge required for the future of this surgery. She is also networking and collaborating with professionals in the field of medicine, AI, and technology. By working together, she can be pioneer novel solutions to the healthcare challenges, driven innovation and transformation for the future of the patient's care. Her goal is to be at the forefront of this transformative journey, contributing to a shameless integration to the medicine technology to the revolutionize the way she approached the healthcare. We welcome you, ma'am, from my organization, from all participants, and I also welcome all the participants, those who are here, and we are eagerly waiting for your speech, which is related to our health. Thank you, ma'am. You can continue your speech.
Thank you, sir. Thank you for the kind words. I will be presenting my screen. I also have a presentation to share with everybody. And am I audible? Is my audio okay? Right. Okay. Good evening, everyone. So, today, my name is Pallavi, and thank you for such a kind introduction. I'm a final year medical student based in Tbilisi, Georgia, and I have developed a deep interest in the future of surgery, especially the intersection of robotics, technology, and healthcare. My long term goal is to dedicate my career to robotic surgery and research, and that helps merging engineering and innovation with clinical medicine. Today, we are stepping into one of the most fascinating frontiers of modern medicine, which is robotic surgery. Imagine a world where surgeons' hand movements are transformed into ultra precise micro movements inside the human body, and that world currently exists, which is very something that is being explored currently in at the moment. So, why does this topic matter, right? Basically, surgery has evolved in clear technological phases, each defined by how we balance access with tissue trauma. For centuries, open surgery was the foundation of all operative practices. It provided direct visualization and access, but at the cost of large incisions, prolonged recovery, and significant physiological stress to the body of the patient. This shift actually began with laparoscopic surgery, where in 1987, where the introduction of camera-guided instruments allowed surgeons to operate through small ports rather than large incisions. Then in 1997, robotic assistants entered the field, marking the beginning of a new era where technology began enhancing human precision rather than simply extending access. Today, We are no longer in a purely mechanical era of surgery. We are in an image guided, digitally assisted, minimally invasive surgical ecosystem. The adoption of robotic surgery is not gradual, it's actually exponential. We're seeing consistent annual growth of 15 to 20% globally, which is a strong indicator of clinical confidence and institutional investment. Today, more than 1 million robotic surgery procedures have been performed every year, with cumulative cases exceeding 8.5 million using Da Vinci systems alone, which is one of the most popular systems being used currently to perform these surgeries. This expansion is supported by infrastructure. Thousands of robotic systems are now installed across hospitals worldwide in different countries based on the access, based on the equipment's resource availability, etc. From a healthcare economic perspective, this is also one of the fastest growing segments in the surgical innovation, with market value expected to be double within a decade for the next few decades that has been planned yet. Clinically, adoption is concentrated specifically in the fields of urology and gynecology, but in general surgery is also expanding its use rapidly as well. What we are witnessing is not just adoption, it's normalization of robotic assisted care. So now, what is robotic surgery? What do we mean by this? Because when we think of it, is it the robots performing surgery or is it something else? Right? It's basically a critical misconception. People think that we let the robots do itself. That's not how it works. Robotic surgery is a surgeon controlled precision system based on master slave architecture. So the surgeon remains entirely responsible for the decision making, operating from a console, like just like a video game, that translates their movements into highly refined robotic actions. The system filters tremor, scale motion, and enhances stability, but does not think or act independently. In essence, robotic surgery does not replace the surgeon; it extends the surgeon's biomechanical limits, to enhance the surgery itself, preventing basic errors with because of tremors or something like that. Now, how does it work? Basically, the workflow of robotic surgery is a tightly integrated system between human intention and mechanical execution. At the console, the surgeon operates in a highly immersive 3D environment that enhances depth, perception, and precision. Every hand movement is digitized, converted into refined micro movements inside the patient. The robotic arms then execute these movements in real time with extreme accuracy, and simultaneously, the surgeon is guided by magnified high definition 3D visual field through a screen that allows precision and precise anatomical differentiation between the structures that are present in the body. So, this synchronization of the vision, motion, and feedback is what defines this entire field itself. Now, this is one of the most popular systems used currently and one of the best systems available in the market. It's called the Vinci surgical system. It's widely adopted all over the world, and it was approved by FDA in 2000 and has become the dominant system in robotic assisted surgery across multiple specialities. It's composed of three integrated units: the surgeon console, as I mentioned, the place where the surgeon controls the system, the patient side, which is the robotic cart, and the vision tower that provides the imaging what is happening in real time. One of the most important engineering achievements is the design of wristed instruments that replicate severe degrees of freedom, to move the hands of the surgeon so that the robotic arm can move according to the surgeon's movements. This allows the surgeon to perform complex maneuvers in a confined anatomical space that would be extremely difficult or impossible if we used laparoscopic instruments because they're limited to a certain degree. I apologize for the background noise, but what are the clinical advantage? So, clinical advantages of robotic surgery are most evident when we examine patient outcomes. Smaller incisions, of course, cosmetically, it is better. Significantly reduced tissue trauma and inflammatory response as well. Blood loss is often reduced, improving surgical safety and reducing requirements for excessive blood transfusions additionally to prevent. Usually, during surgeries, there's a lot of blood loss, and to compensate for it, surgeons usually require extra blood transfusions. But in this case, the blood loss is prevented. Patients typically experience less post-operative pain, which often translates into reduced opioid consumption, reduced painkillers, reduced severe. Usually, patients are given morphine or some sort of an opioid to deal with the pain that happens after the surgery. In this case, the pain is reduced, so you don't really have to give that much of opioid to the patient itself. And the recovery is obviously faster. Patients are mobilized earlier, which has downstream benefits on overall hospital stay. From a surgeon's perspective, this enhanced 3D visualization provides better vision within the patient's body, and also there's some sort of an anatomical clarity, particularly in complex surgical fields, that especially like neurosurgery or cardiothoracic surgery. So a typical surgery which lasts for 4 hours, 8 hours can be reduced to 1 hour or 2 hours because of this precision and the clarity. Along with the advantages, there's a lot of limitations as well. Currently, it carries very, very important limitations at the moment. Most significant is the cost. So obviously, not only the initial investment, which can exceed to $1 to $2 million, but also ongoing maintenance and because of the lack of lack of parts available, there's a lot of maintenance and disposable instrument expenses. It also creates a barrier to adoption in many healthcare systems, particularly in low and middle income countries where there's lack of resources available. And another limitation is that the reduction in tactile feedback. So surgeons cannot directly feel the tissue resistance, which shifts resilience heavily towards visual interpretation. So surgeons have to purely rely on what they see rather than what they can feel. So that is one of the major limitations that is also there. Additionally, successful implementation requires substantial infrastructure and training to the surgeons, which is not currently provided in many medical schools. So it's very resource intensive. It's very it needs a lot of training, which is currently not available in majority of the countries. So where is it used? Basically, robotic surgery has evolved into a specialty platform technology. So urology is the most leading field, particularly for prostatectomy, which is one of the most common robotic procedures globally. There's also gynecology for hysterectomy and myomectomy, which is basically the removal of uterus, removal of tissues around the uterus, especially in complex cases. There's also general surgery, which is hernia repair, abdominal procedures. There's cardiothoracic surgery. It's only used in certain valve interventions, basically the heart certain parts of the heart. Colorectal surgery is rapidly expanding, and also there's complex pelvic dissection where this is used as well. And there's also cross specialty adoptions, especially in the eye. There's ophthalmologic surgery as well. So there are many fields which have been which are using this multi-platform technology to enhance the surgical outcomes for the patient itself. So now, humans versus robots. This is a very common question that's been asked. Will it replace humans? So it's important to understand this is not a competition between human and machine. Human surgeons bring judgment, adaptability, and tactile intuition developed through experience. Robotic systems bring precision, stability, and enhanced visualizations that surpass the natural human limitations. So the strongest surgical outcomes are achieved not by replacing one another, but by integrating both, by working hand in hand. So the synergy is where modern surgery reaches its highest level of performance. And this misconception is very, very widely currently going on regarding the same. That's why it's more about working hand in hand rather than replacing one another. So, what is the future of robotic surgery? It's not simply mechanical, it is more computational and intelligent, because we are moving towards AI assisted systems that can support interoperative decision making in real time. So, AI is also getting integrated into it right now at the moment. There is telesurgery, which has already been demonstrated experimentally, showing that distance may no longer be limiting factor for surgical expertise. Imagine a surgeon doing a surgery on the flight while traveling, and the surgery is happening in a different country. So that is currently happening. That's happening in Germany as well. So there are many countries which is adapting this system. So that's one of the major future that is coming up, one of the major advancements that is coming up. Research is progressing into autonomous subtasks such as suturing and controlled dissection for medical students who need to train into this. Who are it's been implemented in various medical schools across United States. There's also integration with image systems like CT and MRI to allow real time anatomical mapping of the patient itself to see to find the tumor, for example, or check simultaneously, check the CT and MRI while doing the surgery simultaneously. And with the development of 5G networks and latency, the latency is becoming low enough to support near real time remote surgical control. That is a very, very big how can I say, milestone in this field itself. So now, what are the ethical and educational challenges? So with rapid innovations, basically comes complex chief proficiency, which, as I discussed, is currently being adapted, but is not yet advanced completely for now. As adoption, but yes, there is adoption expands, standardization of techniques becomes critical to ensure patient safety. Cost again continues to be a major barrier and contributing to global disparities in advancing the surgical care itself. The integration of artificial intelligence also raises an important ethical question around accountability and transparency in decision making. And these challenges must be addressed alongside with technological advancement. And there are people working on it currently at the moment itself. So, yeah. One of the major case examples that I can give is prostatectomy. As I mentioned, it's one of the most widely used procedures currently for robotic surgery itself, and it's basically the impact of robotic surgery is widely seen in this particular procedure itself. So, compared to the open surgery, it allows for a smaller incision and significantly reduced blood loss. As I again mentioned, patients generally experience fewer post operative complications and faster recovery time, and hospital stays are often shorter compared to and patients can return to their daily life as soon as possible, right? The key value lies not only in surgical precision but improved functional recovery and patient experience. So, the major key takeaway to conclude as to what robotic surgery is and how it is impacting our lives is basically it should be understood as an evolution and an advancement rather than a replacement of traditional surgical practice, because that's one of the biggest misconceptions that is there currently in the field itself. And when we hear, oh, robotic surgery, the first question comes: is the robot doing the surgery, or is it the human doing the surgery? Is it will it replace the doctors, or will it replace surgeons? What is the use of doing so many years of practice of a robot if one can train a machine and get it done? That's not how it works. It's basically working hand in hand. The surgeon remains completely in control, completely the central to the decision making of what is going to happen and how it is going to happen. And the surgeon basically also gets to program the robot in such a way that they can, work hand in hand as well. What this technology enhances is precision, visualization, and procedural consistency, which sometimes can be challenging in certain places, certain regions regarding certain procedures. These improvements translates into better patient recovery and outcomes, because it prevents post-operative complications relatively compared to open surgeries and laparoscopic surgery. It has better outcomes in that particular section. Looking forward, the integration of artificial intelligence will further transform surgical practice, definitely. But also, there's ethical challenges that we have to consider when it comes to patient care, patient confidentiality. All of that is important. But ultimately, the future of surgery is not human versus machine. It's more human and machine working together as a unified system. That's what I wanted to put talk about today. And yeah, if it's the next era of surgery, which I feel is going to be one of the most groundbreaking, one of the most milestone, one of the best form of care that a patient can receive post their surgery. So yeah. Thank you. That is what I wanted to talk about today. If you have any questions for me, they're always welcome.
Thank you, ma'am.
Thank you.
Thank you, Dr. Pallavi madam, for joining and for explaining about the robotic surgery. Really, we were unknown about this term and robotic surgery, what it happens, how it is works independently or without doctor. So all these things where you have clarified what are the ethical practices for that, how it comes in advancedness for the patient to recovery, to take decisions for operative and also for the normal life of the patient. So everyone, this advanced nature is in the favor of the patients, and you are doing great work. Scientists are doing the great work in this field also. We are very much thankful for introducing us in this webinar with the new technology and advanced technology. Now I request participants, especially Dr. Swanand Shukla sir, who is a medical practitioner and professor, he can discuss with you authentically. Thank you, sir. Please welcome.
Good evening, Dr. Betkar, sir. Good evening, ma'am. A wonderful presentation you have given, and definitely this is a very emerging batch, emerging faculty, and no doubt it is the science is expanding forever, so it is still going on. So thank you for your wonderful presentation, really appreciable. My question is, I remember, when we are in operation theaters, we required the help of anesthetist. We required help of, someone will take an incision, and then, so the sister or some nurses should be there behind to give some, sterilized instruments. So can this robotic surgery performs the complex activities what human beings are doing, or they are just doing the primary things?
Thank
Hello.
you. Thank you for the question. Hello. Yes, yes. Thank you so much, doctor, for the question. Yes, actually, currently there has been many. So the Da Vinci system itself, for example, has a place where you can, regarding anesthesia, you have the propofol concentration that has to be set before the surgery itself. So they are trying to enhance advance this particular system itself so that they can replace not replace but work hand in hand with the doc with other staff as well, not just the surgeon itself but with other doctors, with other nursing staff, with everybody else. The main point, the main reason for introducing this technology was to avoid cross contamination, to keep the field as sterilized as possible. And the reason why, as you mentioned, regarding the anesthesiologist, regarding the drug concentrations, to figure out how much, if to increase or decrease based on the heart rate or all of that, that has been considered as well. And there are systems which detects, if in case if there is for example, there is an error in the arm, and if the incision is deeper than required or something, a surgeon can always step in again from scrub in during the surgery itself. But also at the same time, it starts beeping. There's a monitor which indicates if there is any error or for real time, and immediately there will be a team of doctors and nurses to assist with the particular thing currently. But they are planning to automatize this as well. And there is a lot of research going on currently, but because of the limited resources, it has not been implemented yet. So there's still a lot of it's subject to research again. So again, money comes into question again. So that is one of the reasons why it has not been it is being researched about. It is being it is under clinical trials, but not yet implemented directly. So that is my answer to that.
Yeah, thank you. So I think we are using a hybrid mode, the human mind and the technical arms. That is how we are going with. And many of the, you'll find surgery, orthopedic surgeries, and, the cancer surgeries are done by this robotic arms and robotic surgery. So no doubt it has a great future. And a doctor has to, again, they have to orient themselves for such kind of instrumentation and such a kind of technology, because electronics media will be used too much over there. And definitely, it will go to that level, the diagnostic level they can go with. And then after the diagnosis, they can go for the further implementation of the program. The programming will be there, and doctor will be vigilant for that program. That is what we used to see in movies. Right now it is becoming a reality. So that is a really wonderful thing what is happening. And what I feel, about the robotic surgery, what you said, that the contamination, or the hospital infections, iatrogenic diseases will get reduced substantially, if there is no human intrusion in the, operative procedure, surgicals. But only the thing is cost effectiveness, for the even for the doctors to have such a kind of a what we can say hospital setup and everything, and for patients also how much they have to pay. That is the more concern in India. But no doubt, in India also we are having these robotic surgeries going on. Very means there are hospitals in every city, they are working on this. But I think, the robotic surgery, when we are saying, You said that there are certain human errors takes place, that sometimes we may have some kind of tremors or sometimes anxieties, or we are not in a emotional state to conduct that surgery, so that those problems can be reduced. But there is the other side also, like sometimes we have to think in on the, during the surgery on table only we have to take certain decisions. Like I remember, I was attending one surgery about the fistula nano, and they were digging out the path, and that is called saucerization, and they reached to that level where the sphincter was there. And then question came, if we are giving incision to sphincter, he will lose control throughout his life. And then we have stopped over there. Then let's see further what we can do, because the risk and benefit balance we had to see. So we have stopped in between. So we have to think about this also, because the if once we are giving some program, the machine will work by its own. But there are certain decisions we have to take, critical decisions. So that is how when we will go, means 100% we are using techno for the surgical interventions. I think this problem may come, that human mind, the thinking that whether it is right or wrong, that conscience will be there. So what do you think about this? Thank you very much.
I completely agree with you, Doctor. I completely agree with you regarding the human mind, the critical decision making that happens during the surgery itself. To curb that, actually, robotic surgery is not about pre-programming the robot. It is basically working with the robot during the surgery itself in real time. So it is basically like a video game. So the surgeon puts the hand inside the machine, and the surgeon is doing the surgery during the while the robotic arm is operating. The robotic arm is just like it's following the command of the surgeon. So if there is any decision making that is happening, it's happening real time. So I feel that is has already been understood by the surgeons itself, and they have already started working on it regarding that, and it has already been implemented. So currently, I also had one of my doctors telling me about this. He was in Germany and he was performing the surgery as well. And he mentioned that during the mid surgery, he had to stop and he had to leave. And he did not know what to do at that stage because they had not detected a mass and they detected it then during the surgery. It was not shown in the CT. So they had to. Stop the surgery. So they could stop the robot, and then the robot backed off, and the surgeon continued after some time trying to fix it. So it did work. So I feel that that issue has been, tackled as already. So I feel as we advance more, there might be more solutions to it. Maybe in a way, every system has its own pros and cons. So I feel that will be definitely handled eventually as research progresses. Again, thank you.
Thank you. Definitely, it will progress and it will go to that level, where you'll find the programmings will be there, pre-planned, operative procedures will be there. No doubt the critical care has to be handled by human beings only. But cataract operations, nowadays people are doing it mechanically. In one day, they are finishing about 100 of, cataract operation from morning to evening. So it is very much possible nowadays. So a wonderful explanation you had given about the robotic surgery, and very important aspect what I want to again emphasize that when the human beings are intervening, there are possibilities of contaminations and there are possibilities of bacterial viral infections. They are very common in hospitals, and this can be avoided with the robotic arms and robotic surgeries. So thank you very much, ma'am.
Thank you, Dr. Sir. You are the single person in this group who can understand the technical term of the medical field. So you have nicely discussed, effectively discussed with the speaker, and your interaction is very useful to all of us to know the basic knowledge about the robotic surgery and the aspects of it and the future of it. Thank you, doctor. Thank you. Now I request other participants they can discuss with our speaker. Thank you, Dr. Pallavi Madam.
Hello.
Yes,
Hello, can I ask a question, please?
yes, sir. Yes, sir. Please.
Are there specific patient populations in which robotic surgery shows clear advantages, like obese, elderly, or like any specific populations?
Yes, currently there hasn't been any trials. So surgeries currently aren't being performed on elderly patients because mostly because of post-operative problems, post-operative issues. But I believe there's not a particular patient population as such targeted for the surgery itself. There are many surgeries which, depending on which type of surgery it is, there are many surgeries being performed in many sectors, especially your urology. Typically, it's mostly targeted since prostate problems are mostly common in elderly male patients, not above 65 but below that. So it's a robotic surgery is used in that. There are many situations. It depends on the case. Depends from case to case. Depends from patient to patient, and also depends on the adaptive because before we recommend the surgery itself to a patient, we have to ask for their consent. We also see if they're fit for the surgery itself. And since it's an upcoming field, it's not really that popular amongst patients itself because of the cost as well. So not a single population targeted, but it's mostly as to who. It depends on the case again. So yeah, that is my answer to that.
Thank you, sir, for discussing with our speaker. And we are very much thankful to our today's speaker, Dr. Pallavi Pai, madam, for accepting our invitation and delivering the topic very perfectly. You have joined here, calculated your time of joining, and you have prepared a very perfect PPT also, so that it can be read and it can be understood everyone. In future also, we invite you as per your available time, and we also request you. You can recommend few speakers, those who are your contact, because this is the daily series and we need speakers having different knowledge and different subject. Thank you, ma'am, for your valuable time on this platform. Thank you.
Thank you so much for inviting me, and I'll definitely forward this series to my other friends as well, whoever has to speak about any particular topic they're interested in. Thank you so much for inviting me, and thank you for listening to my talk as well. Thank you. Thanks a lot.
Okay, thank you. Participants are requested to fill the feedback link, which is available in the feedback chat box, so that they can issue their certificates.